Hello everyone, in this video I will discuss everything to do with tennis elbow, and then I'm gonna show you how to perform some diagnostic tests at home by yourself in order to confirm or rule out tennis elbow or lateral epicondylitis, and then I will show you treatment modalities as well as rehabilitation exercises. Tennis elbow is a lateral epicondylitis. This is a painful musculoskeletal condition which is caused by micro tearing of the common extensor tendon due to overuse and strains from repetitive movement such as gripping or wrist extension. Despite the name, this injury is actually more commonly seen in people who perform manual jobs, such as plumbers, painters, carpenters, etc. And only about 5 to 10% of the people affected develop it from playing tennis or other racket sports. This condition is fairly common. It affects 1 to 3% of the world population every year, and it mostly affects people in their 40s and 50 years old. Men and women are also equally affected. Traditionally, lateral epicondylitis was seen as an inflammatory process. However, recent studies have determined that this is a tendinosis, which means that the tendon is damaged but there is no inflammation. This is different from a tendinitis, because in a tendinitis there is an inflammation in the tendon. Contrary to a common belief, if there is no inflammation, this is not a good news, because inflammation is the first healing response from the body. As you can see from the diagram, there are permanent changes within the tendon, and this results in the tendon becoming thicker as well as weaker. And so the treatment modalities and the rehabilitation exercises, they focus on re-strengthening the tendon as well as stimulating new tissue growth. In regards with the symptoms, there are 4 stages of the injury. The first is a dull ache, which comes a couple of hours after the provoking activity and only lasts for a little while. The second stage is pain at the end or immediately after the provoking activity, and usually also lasts not too long during the rest of the day. The third stage is pain during the provoking activities, which intensifies after ending that particular activity. And the fourth stage is a constant pain, which prevents to perform any provoking activities. Now, as you can imagine, you might want to start the treatment when you are in stage 1 or stage 2 of these symptoms for the best recovery, as well as trying to prevent the permanent changes that they occur within the tendon. Pain is certainly the most prominent symptoms. However, the pain can also radiate upward along the arm or downward towards the forearm, and in some cases all the way up to the 3rd and 4th finger. Weakness can also be present, as well as a burning sensation over the elbow, especially in the common extensor tendon area. There are a few risk factors associated with the lateral epicondylitis. We see manual labor, dominant arm involvement, longer duration of the symptoms, as well as poor coping mechanisms, which are associated with the poor prognosis. And now let's look at some diagnostic tests. Hello guys, here is the Cousins test. Have the elbow at 90 degrees, pronate the arm so that the palm of your hand is facing down, make a fist, and now you want to radially deviate the wrist in this movement there, and then with the hand you want to place it on top of the fist, and now you want to push the fist upward. So the fist is doing this and this hand is resisting. This way we are going to activate the muscles of the forearm. If you have pain in this place here, it's a positive test. Now I'm going to show you the chair test. We're going to use these 3 fingers here to pick up a chair, and then you want to try to lift it up. If you have symptoms here, it's a positive test. This is the Mills test. For this test, we are actually trying to stretch these muscles to see if there is pain or not. Make a fist and then bend the fist down, And now with the other hand, stretch the elbow. If you have symptoms in this area here, it's a positive test. Coffee cup test. You can use a coffee cup or you can use a bottle of water, and you want to hold the bottle of water like so, or the coffee cup. Hold it for about 10 seconds. If you have symptoms in this area here, it's a positive test. It's important to note that at least 2 out of these 4 tests should be positive in order to suspect lateral epicondylitis. And now let's look at the treatments. In the initial management of lateral epicondylitis, we usually suggest non-surgical treatments. These include rest from the aggravating activities, putting ice for 10 to 15 minutes 2 to 3 times a day. Physical therapy is also really good in order to prescribe the correct exercises as well as hands-on treatment. The treatment might also include dry needling or shockwave therapy, which have been found to be fairly effective against tendinosis. Then we also have a medication. This includes a non-steroidal anti-inflammatory medication such as ibuprofen or Nurofen, as well as painkillers such as paracetamol. And in case the symptoms persist and the pain does not go away, your doctor might also suggest to perform some steroid injections. Other types of medication, such as stem cells therapy or PRP injections, are also available to stimulate the healing of the tendon. Together with any of these treatment modalities, you also want to do your rehabilitation exercises. After trying all of those modalities, if there is no major improvements between 6 to 12 months, this is when surgical options are then suggested. And there are 2 main surgical treatments: open approach or arthroscopic approach. And now let's look at the rehabilitation exercises. Okay guys, so this is the rehab program that usually we suggest for lateral epicondylitis. We're going to divide the program into week 1 and 2 and week 3 and 4. Week 1 and 2 we are going to use the muscles of the shoulder, especially the serratus anterior, and the muscles of the forearm in an isometric way. Isometric simply means there is a contraction but there is no movement at all. So if you make a fist and your bicep is contracted but there is no movement, this is isometric contraction of the bicep. And so first muscle to exercise is the serratus anterior. The serratus anterior does this movement here. If you have your arm outstretched and now you want to push the shoulder forward and backwards. Now you want to place your hand against the wall and you want to push against the wall by contracting the serratus anterior, but as you can see there is no movement. So the muscle is in isometric contraction. You want to hold it for about 10 seconds. And then you want to relax for about 5 seconds, and you want to do 3 sets of 10 contraction. Next we are going to use the extensor muscles of the forearm. The extensor muscles of the forearm will do this movement here, so they are going to push the hand or the fist up. So we want to contract the muscle and we want to hold it there for about 10 seconds, and then you want to relax for about 5 seconds. Again, you want to be doing 3 sets of 10 of this exercise. After week 1 and 2, we want to start to put some resistance against those muscles. And so what you want to do with the serratus anteriors, you can do this with one hand or with both hands. You want to go against the wall, and now you want to protract the shoulders and back. Protract and back. If this is very easy, you can do this exercise on the floor or on an inclined position. For example, you can use a chair. Place yourself in this position here, and now let your shoulder drop, keep the elbow straight, and then you want to push yourself up and drop and push yourself up. Again, you want to be doing 3 sets of 10. Another way to exercise this muscle will be with a rubber band. You want to take a rubber band, and now what you want to do is you want to place yourself in a very good position, and with the hand you want to be pushing forward and back. Pushing forward and back. Forward and back. And again, you want to be doing 3 sets of 10. Extensor muscles of the forearm, again, we want to add a little bit of resistance. And so you want to take a rubber band, lock it with your foot. And now from this position here, you want to push the fist up and down, up and down, up and down. Make sure that the rest of your body is nice and straight. If you don't have a rubber band, you can just use a weight. And so from this position here, you go up, down, up, down, up, and down. And again, you want to be doing 3 sets of 10. Together with these exercises, during week 1 all the way to week 3 and 4, you can also do some self-massage of this area here and application of ice in this place here for about 10 minutes. You can do them 2, 3 or even 4 times a day. And also you want to start to do some stretching exercises. The stretching exercises during the week 1 and 2, they might be aggravating, so you might have some reproduction of symptoms. If that is the case, either postpone them for when the symptoms they will subside, or just don't stretch as much. And I have a video for forearm stretches that you can watch. As well as the rehabilitation exercises I've just shown you, you might also benefit from elbow mobilization exercises, elbow stretches, self-massage of the elbow, and ice like we spoke before. And then you can also use wrist splint as well as adjusting your ergonomics. This might include standing up desks, external keyboards, etc. As always, if you have any question, please leave a comment below. Thank you for watching, have a great day.